you see ticks on a dog, that's a pretty easy diagnosis. If you see warts in an older dog, some things like acrylic granulomas, feline acne on the chin, and then rare diseases, which we'll very quickly touch on, but you may see once or twice in your career, but they're pretty definitively obvious once you know what to look for. So that's one strategy. This is a very clear disorder, and that's the easy part of veterinary dermatology. Unfortunately, what we usually end up with is much more of a stew. So instead of having one or two ingredients or one and two disorders affecting the skin, we have a series of different things that are piled on each other, almost like an onion, where we have to go through layer by layer and treat all of the different issues in order to have a successful outcome. So if we look at this dog that has focal hair loss, then the two most important questions to ask about any patient in dermatology are, what are the infections? Because 80% of dogs with any kind of allergy or hormonal imbalance are going to have secondary infections with yeast or bacteria. Most of the actual symptoms that we're looking at or assessing in the exam room are caused by those secondary infections, but the infections are triggered or caused by that underlying primary disease, typically allergies or hormonal imbalance. So like the stew, we don't have just one ingredient. We have bacteria, yeast causing the actual hair loss and red skin, but that's been triggered by the underlying disorder, typically allergies or endocrine disease, like the stock of the stew. So for instance, this is a kitty cat, and these are all heads of cats. And so you can look at these and say, well, they all have this kind of hair loss with a crusting alopecia. And, they look pretty similar. But in fact, one cat has pemphigus, which is an autoimmune disease. One cat has ringworm. One cat has Demodex gatawart, which is a contagious parasite causing itchiness in cats. And one cat has paraneoplastic disorder, which is cancer of the liver or pancreas, and is going to be dead in a few months. And looking at these cats, you can't really tell just by the appearance. They all have head and neck dermatitis with alopecia and focal crusting rash. So we need to have other techniques and a strategy to actually figure this out. So our ability just to look and say, oh, this is a single disease, works for some issues like ticks or warts, but the majority of the cases are going to be lists of differentials that can all look similar. And so if we look at hair loss or alopecia in dogs, if you called me up for a consult or emailed or texted me, we have two dogs here that would be classified as alopecia, but one dog has baby butt smooth skin with hair loss, alopecia, and the other dog has kind of sickly appearance, weight loss, and a crusty, bumpy, infected looking skin. But if I simply say, what are the differentials for alopecia? Turns out that there are about 256 differentials for hair loss in dogs. And so just that one symptom is not really going to help us narrow down our list of different possible disorders or differential list for that disease. So a better strategy for this is going to be using pattern analysis. And this works very well in veterinary dermatology. So if I said list all the dogs with brown hair, that list would be very, very long, like all the dogs that have hair loss or alopecia. It's a very long list. However, if I show you a picture of a brown dog, it's very easy to say that this dog is a dachshund, this dog is a German Shepherd, this dog is a golden retriever, and this dog is a boxer. So we're going to try to look at our disorders in veterinary dermatology and use a pattern approach. Do we have autoimmune pattern, which is nasal planum, pinna, pads combined? Do we have more of a food allergy pattern, which is ears and rears? And by doing these sort of pattern analysis, we're going to be able to shorten our differential list and come up with tentative diagnosis and treatment plan much more efficiently. Okay, so the order of the lectures is based on 10 common patterns, and this is part of a DocItchy derm system that I've put together in YouTube videos at DocItchy that you can look at that sort of go through these different main focal points. And so veterinary dermatology can be divided up into these 10 categories, and it can be much more subtle and nuanced than this, but these 10 categories will get us down the path of diagnosis and treatment relatively quickly. They do interact, but you can see sort of the two most important questions that I mentioned are what are the infections, and then why are they there? And so this is organized in that sort of system approach. So we have what are the infections, and we can have the three causes of folliculitis, which is hair loss with a crusting rash, and that's bacterial pyoderma, demodicosis, and dermatophyte. If you remember the two drugs that can cause demodicosis, it would be useful to remember that. And then yeast infections, pododermatitis with the feet, and otitis. And it turns out that otitis is actually the #1 insurance claim in dogs year after year after year. So we want to treat the otitis, but more importantly, we want to figure out why it's there, what's triggering it. And that comes down to the underlying disorders, whether that's allergy or endocrine disease. And then further, based on the pattern of itch and lesions with allergy, does it involve the feet, which is typical of atopy, pollen, environmental allergies? Ears and rears is food allergy. Pinnal-pedal reflex is scabies. Hot spots on the back, lumbar area is going to be insect allergies. We all obsess about fleas, but it could be mosquitoes, chiggers, or mites. And then endocrine disease, big dogs get hypothyroidism, small dogs get Cushing's disease. So again, a relatively manageable list of disorders. This is the DocItchy derm system. And you can see that this is a history form that we have our owners fill out. But in questions that we have, what are the infections and why are they there? They're represented on this form. And then we have color coding here that sort of helps you connect the dots so that if you have a lot of pink check marks, those kind of relate together. So do we have other dogs or have a lot of wildlife in the area? Do we have lumbar dermatitis with hot spots? And then what are our current flea and tick products? Are we on a new generation isoxazoline? So this form and the DocItchy derm system is designed to walk you through those two questions. What are the infections? Why are they there? To get you to an efficient answer and treatment plan pretty quick.